I'm Brandon McCulloch. I'm a firefighter paramedic with the Fort Worth Fire Department. Today we're going to go over our BVM and some of our max BVM techniques. This BVM that we're going to use today has a manometer on it that's going to give us kind of a gauge on what we're doing to show you that we don't have to really use a full grip for squeeze when we're ventilating a patient, and kind of give you a gauge on what you're going to be doing and what we're looking for when we're doing max BVM on a patient. All right. If you'll notice, we've got this patient set up for max BVM. In doing so, we've got him set up with a nasal cannula that's high flow, hooked up to one oxygen source, another oxygen source hooked up to our BVM here. If you've got one person, you can do the typical EC grip. E, 1, 2, 3, makes your E, C, makes your C. As you put your mask on your face, you're not pushing this mask down into the face, rather you're pulling the face into the mask and pulling the jaw up. That creates a good seal where you're getting your chest rise as you're ventilating. Today on the Doctor's In, we're just going to review the thenar grip. We're seeing that basic airway management is becoming an issue. A lot of us take for granted how easy basic airway management can be when simple things like your grip and mask seal can fail and cause inadequate ventilation. So as we all know, typically with one rescue, you're going to start with the EC clamp, going like that. Not a very efficient way of delivering those ventilations as we found through studies. The preferred method is the thenar grip. The way I like to remember the thenar grip is thumbs to patient's toes, thenar. So thumbs to toes, thenar. And you are putting both of your thumbs in line on the sides of the mask, pointing towards your patient's toes. You are wrapping your fingers under the patient's mandible, and you are pulling his face into the mask itself versus pushing the mask down on there. And then at this point, you're in a 2 rescuer mode. Your second rescuer will give the ventilations as needed. This is creating a superior seal to the one person EC clamp, and being sure that you've got the proper grip on this is vital in making sure that it works effectively. On this BVM, we have a manometer to kind of illustrate where we want to stay and how much of that bag needs to be squeezed. If you look closely on this one, that stays within a green, but look closely at how the bag is being squeezed and how hard and how little it really takes to properly ventilate a patient without causing barotrauma.